tous. Bonjour à tous. Hello, everyone. Yesterday, we marked 1 year since the pandemic officially began. No matter who you are, getting through the last 12 months has taken strength. It has taken courage. But above all, it has taken hope. There are still many days to go in this pandemic, but each one that passes, just like each person who gets a vaccine, brings us closer to the better days ahead. À ce jour, on a
To date, we have delivered more than 3.8 million doses of COVID-19 vaccine to provinces and territories. We'll be receiving million more doses by the end of the month. And as of April, we'll begin to receive even more rapidly. This week, Major General Fortin's team at the National Operations Center conducted a rehearsal exercise with partners from the industry, as well as federal, provincial, territorial, and Indigenous partners. This rehearsal served to determine that we are ready for the fast-track delivery phase. All resources are being devoted to this. Last night, we had our 28th First Ministers meeting. We issued a joint declaration to highlight the one-year anniversary of the heroes who are working on the front line in the health field. We recognized families that had lost loved ones, and we emphasized the importance of continuing to work together, to being there as a team. Canadians all across the country. We will continue to do so, and we will continue to be here for you.
New delivery schedules from Pfizer, I can confirm that Canada will receive at least 1 million Pfizer doses per week from March 22nd to May 10th. 1 million doses of Pfizer alone every 7 days. That's going to make a big difference. We have shared these updated delivery schedules with the provinces and territories. This is so they can continue to plan for mass vaccination sites to get you and your family protected as soon as possible. Every dose makes a difference. Last week, Susan from DDO in Montreal wrote to me to say that she and her husband, who are both seniors, had gotten their first dose. She told me about the relief they felt after a year of worrying. Susan, je suis content de savoir que vous et votre mari soyez enfin plus...
Susan, I'm happy to hear that you and your husband now feel safe. As I've mentioned before, anyone who wishes to be vaccinated will be able to do so before the end of September. One of the best ways to protect yourself against the virus is to be vaccinated. And if you have already become vaccinated, it's important to remember to continue to do your part to ensure that others remain safe. Winter has been long, and we're all impatiently waiting for spring. As Canadians, with our wide open spaces, we like to spend time outdoors. This past year, especially after days of Zoom meetings, a lot of people rediscovered how wonderful it is to go for a walk outside or to take the kids for a bike ride on the weekend. It's important to be able to get out and walk or move around. That's why, over the last 5 years, we've made investments across the country in projects such as Kelly's Brook Path in St. John's, Newfoundland, and Grouse Mountain Trail in Vancouver. These projects are not just designed to make hiking paths or wheelchair accessible paths up to bus stops rather. They allow everyone to get out and get moving, and they help us build stronger, healthier communities. In this respect, we're entering a new phase today.
Kenna announced earlier this morning, we are investing $400 million for bike lanes, trails, and pedestrian bridges across the country. This is part of our historic public transit investment over the next 8 years and our plan to create 1 million jobs. This will lead to stronger communities, clean air, and new jobs. And that's a win-win. And that's our blueprint to come roaring back from this pandemic. As we rebuild from this crisis, it's up to us to create the kind of Canada we all want to see, a country where everyone has what they need to succeed. Right now, one of our top priorities is ensuring that no one misses out on vaccines. This includes Indigenous communities, which are particularly vulnerable to the virus. Vaccination is underway in over 530 Indigenous communities and communities in the territories. And for Indigenous people living in cities, we're working with the provinces and territories to get everyone their shots as soon as possible. Of course, keeping people safe and ensuring communities have the resources they need doesn't end with vaccines. And on that front, this morning, I want to talk about where we are with long-term drinking water advisories. Earlier this week, we marked an important milestone in our partnership with First Nations communities, the lifting of the 101st long-term drinking water advisory since we took office. Thousands of homes now have clean water. That's real progress, but I know that there is more work to do. As Minister Miller has said, we will not stop until everyone in every community has access to clean water. Finally, I want to end this morning on the news that the Canadian economy gained 259,000 jobs, both part-time and full-time, in February. For the workers who are back on the job and for their families, this is the good news they need. Every step of the way, our focus has been on supporting Canadians through the storm. But let's not forget there are still far too many people for whom things continue to be really tough. If that's you, know that you're not alone in this crisis. We're here to help you get through it and get back on your feet. That's exactly why we are extending the Canada Emergency Wage Subsidy and the Canada Emergency Rent Subsidy and Lockdown Support at their current levels until June, as I announced earlier this month. For places like the Hamilton Conservatory for the Arts, the wage subsidy has been the difference between having to shut down or keeping people on the payroll. And it's the same story for millions of workers right across the country. Quand on a créé la PCU en mars dernier,
When we created the CERB last March, I remember telling you that we would give you the support you need when you needed it. And that hasn't changed. That will never change. Together, we're going to get through this. Thank you, and I'll now give Dr. Tam the floor.
Bonjour à toutes et à tous. Today, we'll start with a numbers update, closing out a week of remembrance with renewed commitment to the efforts that will shape our future. Today, there have been 899,757 cases of COVID-19, including 22,371 deaths and over 30,670 currently active cases reported across Canada. And over the past week, an average of over 3,050 new cases and 31 deaths were reported daily. At the same time, over 2,050 people with COVID-19 were being treated in our hospitals each day, including about 540 in critical care. To date, close to 3,000 variants of concern cases have been reported across Canada, with the B117 variant accounting for over 90% of these to date. During the past year, and in the lead up to yesterday's National Day of Observance, I received many notes from Canadians sharing their reflections on the year that was, including the heartbreaks and the lessons that were revealed along the way. To all those who have lost loved ones during a year when we could not ease their passing or memorialize their lives as we would have, I extend my deepest sympathies. Though difficult times have passed without them, the day will come when we can gather again with friends and family to honor their memory and celebrate their lives. As vaccine programs continue to escalate, more than 2.7 million doses of vaccines have been administered across Canada. Over the past week, provinces and territories have administered close to 600,000 doses of COVID-19 vaccines, which is the highest number of vaccines administered in a single week since vaccination began in mid-December. We are making progress every day, and as the snow melts and the first day of spring is just over a week away, I know that we're all anxious for the finish line on this long marathon. But right now, racing towards the finish could cost us the success we've worked so long and hard for. Right now, we need to run the mile we are in and keep to a steady, cautious pace. Let's all continue to support Team Vaccine by not providing any opportunities for Team Variant to gain more ground. Before I close, I would like to say a special word of thanks to the incredible public health workforce in this country and around the world. Dedicated people, too numerous to count, have and will continue to work tirelessly behind the scenes, not just since COVID-19 was declared a pandemic, but in the lead up, during, and long after. From those who test and trace at the local level to those who bring us the latest numbers and pore over emerging evidence that shapes and adapts our guidance across every area of the response, thank you. This is truly the largest, most complex response in the history of public health, and the public health workforce in Canada has been dedicated to giving their best efforts every day. On behalf of all these quiet heroes, I dedicate my closing public health message. Please remain vigilant, follow public health advice, and keep up with individual practices that protect us and our families. It is up to you plus public health. Thank you.
Bonjour à toutes et à tous.
Hello, everyone. We'll start our today with the latest numbers, closing out a week of remembrance with renewed commitment to the efforts that will shape our future. To date, there have been 757,000 cases of COVID-19, including 22,371 deaths and over 30,670 currently active cases reported across Canada. Over the past week, an average of over 3,050 new cases and 31 deaths were reported daily. At the same time, over 2,050 people with COVID-19 were being treated in our hospitals each day, including about 540 in critical care. To date, close to 3,000 variant of concern cases have been reported across Canada, with the B117 variant accounting for over 90% of these to date. During the past year, and in the lead up to yesterday's National Day of Observance, we have received many notes from Canadians sharing their reflections on the year that was, including the heartbreaks and the lessons that were revealed along the way. To all those who have lost loved ones during a year when we could not ease their passing or memorialize their lives as we would have, I extend my deepest sympathies. Though difficult times have passed without them, the day will come when we can gather again with friends and families to honor and celebrate their lives. As vaccine programs continue to escalate, more than 2.7 million doses of COVID-19 vaccines have been administered across Canada. Over the past week, provinces and territories have administered close to 600,000 doses of COVID-19 vaccines, which is the highest number of vaccines administered in a single week since vaccination began in mid-December. We are making progress every day, and as the snow melts and the first day of spring is just over a week away, we know we are all anxious for the finish line on this long marathon. But right now, racing towards the finish could cost us the success we've worked so long and hard for. Right now, we need to run the mile we are in and keep to a steady, cautious pace. Let's all continue to support Team Vaccine by not providing any opportunities for Team Variant to gain more ground. Before concluding, we would like to say a special word of thanks to the incredible public health workforce in this country and around the world. Dedicated people, too numerous to count, have and will continue to work tirelessly behind the scenes, not just since COVID-19 was declared a pandemic, but in the lead up, during, and long after. From those who test and traced at the local level, to those who bring us the latest numbers and pore over emerging evidence that shapes and adapts our guidance across every area of the response. Thank you. This is truly the largest, most complex response in the history of public health, and the public health workforce in Canada has been dedicated to giving their best efforts every day. On behalf of all these quiet heroes, we dedicate our closing public health message. Please remain vigilant, follow public health advice, and keep up with individual practices that protect us and our families. It's up to you, plus public health. Thank you. Thank you, Dr. New. We'll start the question period, the 20-minute question period with the Prime Minister. You can have one question and one follow-up question. The ministers will be available for another 20 minutes.
Today, for 20 minute, one question, one follow-up. The ministers and doctors will remain available afterwards for another 20 minutes. Starting with the phone, en commençant par le téléphone. Opérateur, c'est à vous.
Thank you. Merci. For questions on the telephones, please press *1 on your device's keypad. Pour toute question au téléphone, faites *1 sur votre appareil. La première question, Marie Vastel, Le Devoir.
First question, Marie Vastel, Le Devoir newspaper. Hello, Mr. Trudeau. I'd like to come back to what you said this morning on CTV. The idea of a vaccine passport. You seem to distinguish between an international vaccine passport and one that would be required for certain domestic activities, if I can say this. You talked about the question of charter rights. Is that the problem? And are you excluding the idea of a vaccine passport domestically? Answer, I'm not excluding anything, Marie. We'll see how the next months unfold. First, we need to ensure that we get back to normal, and also we need to protect Canadians as much as possible. But we can clearly see that there are two issues with regard to vaccine proof or certificates. One is that we would need vaccination proof to travel internationally. Now, that's something that's existed for a long time. When you travel to certain countries, you need to demonstrate that you've been vaccinated against certain diseases, tropical diseases, for example. Otherwise, you'll be refused entry. So this is a well-established practice, and it's something that countries are actively exploring, and we are among those countries. Now, when it comes to distinguishing people who have been vaccinated and others who have not within our own country, there are questions of fairness and justice that come into play. There could be discrimination, for example. I understand that we want to encourage and motivate everyone to become vaccinated. That's how we'll get through this. But we need to think of people who, for medical reasons, for example, or for other circumstances, cannot or do not want to be vaccinated. We also need to think of justice and fairness as we consider this question. That's something I've said since the beginning, but we're continuing these conversations.
It's obviously important to highlight that we want to encourage and motivate people to get vaccinated as quickly as possible. Getting as many people vaccinated as quickly as possible is the way to restore a semblance of normality in the coming months. And of course, we're going to make decisions step by step and look at all sorts of different ways, both to encourage people to get vaccinated and keep people safe. The idea of certificates of vaccination for international travel exist already and are well established. There are countries in the world where you shouldn't go unless you can prove that you've been vaccinated against certain tropical diseases, for example. That's well established. But the idea of certificates of vaccination for domestic use to decide, if who can go to a concert or who can go to a particular restaurant or engage in certain activities does bring in questions of equity, questions of fairness. There are some people who, because of medical conditions or other reasons, will not be able to get vaccinated. There are others who are not on priority lists who will have to wait much longer before getting vaccinations. These are things that we have to take into account so that, yes, we're looking to try and encourage everyone to get vaccinated as quickly as possible, but we're not discriminating and bringing in unfairness in the process at the same time.
En suivi, Marie?
Follow-up question, Marie? Yes. You just repeated the answer you gave this morning to CTV. What I want to know is if there's a risk of discrimination, why are you not excluding a domestic vaccination passport? When it comes to an election, however, you've said that you would like to be able to continue to manage this crisis until everyone's safe. I'm paraphrasing, of course. Are you now excluding any possibility of an election if everyone is not vaccinated, rather? What is your criterion to say that you've come through this crisis? Answer. I understand, Marie, that the opposition parties and parliamentary journalists have elections on their mind. I am not thinking of elections right now. My priority is COVID-19. It's this pandemic. It's rebuilding the economy as quickly as possibly, as well as possible. That's what we're working on, and we'll continue to work on these issues.
Thank you. Merci. Next question, Charlie Pinkerton, iPolitics. Line open.
Good morning, Prime Minister. There was a story in the New York Times yesterday about tens of millions of doses of AstraZeneca's vaccine that's sitting in American facilities. And that's because the states themselves, they haven't approved the vaccines, they're not being used. But the Biden administration won't approve their shipment to the European Union. Has your government reached out to the Biden administration about Canada being able to access these?
Over the past weeks and months, we have engaged with all different vaccine companies, with all of our allies to talk about getting more doses to Canadians as quickly as possible. Those conversations will be ongoing. We will continue to look to get as many Canadians vaccinated as quickly as possible so we can keep people safe and bring our economy roaring back. Those conversations will continue with everyone. Depuis des semaines et des mois, nous parlons.
For weeks now, we've been in talks with the various vaccine companies and partners around the world with regard to our desire to vaccinate Canadians as quickly as possible so that our economy can be brought back to normal and people protected. These conversations will continue.
With respect, Prime Minister, you did not directly address the question. Have you spoken to the Biden administration or anyone in your government spoken to the Biden administration about freeing up these tens of millions of doses of AstraZeneca's vaccine that are sitting in American facilities?
Over the past number of months, we've had lots of great engagements with the American administration on COVID-19, on working together to keep people safe, on vaccinations, on border measures. Those conversations with the Americans will continue as they do with all our partners. Au cours des derniers mois,
in the last months, we've had many, many conversations, including direct conversations with between me and Mr. President Biden on the need to vaccinate our citizens, on cooperation, and the need to continue to protect people through border measures. And we'll continue to have those discussions.
Dernière question au téléphone avant de passer dans la salle.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Catherine Lévesque, La Presse canadienne. Question. I'd like to come back to your meeting with the First Ministers of the provinces and territories yesterday. I'd like to know if they have, I know that they asked for a $28 billion health transfer. What did you answer to them? Answer. We continue to have very good meetings with the First Ministers of provinces and territories, first of all. This was our 28th meeting, and I can tell you that we had a very positive conversation. It was obviously focused on this unfortunate anniversary, the one-year anniversary since the beginning of the pandemic, and the work that we are all doing together to ensure that in the weeks to come, Canadians will receive the support and the vaccines that they need to get through this. We spoke of various vaccine procedures, how to increase the average, how to increasing the number of vaccines arriving. And I told them that we are here to support the provinces and territories, as we are also here to support the citizens, Canadians, and have been since the beginning of this pandemic. As for health funding questions, we are going to continue to be supporting the provinces and territories. As for the long term and our healthcare system, we will be having these discussions once we get through this temporary crisis. I recognize that we need to increase healthcare transfers in the long term, but we've sent a great deal of money and funding already to the provinces, and we want to ensure that people can get through this pandemic. Follow-up question? I understand then that the question was discussed, if I read between the lines. Why is it that we still don't have a date for the budget? Why are you waiting until April before releasing a financial statement, economic statement? Don't you think Canadians would like to know more? Answer. Since the very beginning of this pandemic, we've been very transparent with regard to the investments we are making to support families, workers, provinces, territories. We are going to continue to do so. We'll be open about the fact that we're here to support Canadians. We'll provide what is needed for as long as needed, as is needed. That's the promise we've made to Canadians, and we'll reveal the budget date in the weeks to come. But Canadians can be confident that our approach is to be here for them to invest in communities and to ensure that Canadians succeed and are safe. This is not every political party's opinion. The Conservative Party is saying that we're doing too much, too quickly. These will surely be conversations that we'll have again when it comes to the budget. But we have had good news with regard to the economic recovery, and that's related to the investments that we've made to ensure that Canadians can get through this crisis in the right way. We'll go to questions in the room now.
My name is Mal Hamidian with the Canadian Press. You have talked repeatedly over the last half year or so about building back better, and you have also you had actually to repeatedly hold off on bigger picture plans in favor of extending temporary measures and programs to help Canadians through the pandemic. What economic or other markers are you looking for in switching from crisis response to bigger picture recovery?
Well, I think everyone knows that we have to get through this pandemic. We have to make sure that Canadians are safe. That is the top priority of this government, and that will continue to be the top priority of this government. At the same time, we recognize that one of the best ways of ensuring that our economy comes back strongly, comes roaring back as we get through this pandemic, is to make sure we're giving Canadians the right supports throughout this pandemic. That's why we made a simple promise. We'd be there for people as long as it took, as much as it takes. And that's what we're going to stick with.
Next question in the room.
Mr. Trudeau, Chris Nachkate, CTV National News. President Joe Biden last night said Americans are going to be able to have a July 4th barbecue because every American will have their shot by then, a somewhat return back to normal. When are you going to formally change your vaccination timeline for Canadians?
The big vaccination timeline that we have been talking about for a long time now has always been the end of March. And we had a goal of vaccinating or getting 6 million doses into Canada by the end of March. We're now looking at over 8 million doses by the end of March. So that is good news. We have also made repeated commitments to Canadians that everyone who wants to get vaccinated will be vaccinated by September. That continues. But in my conversation with the provinces last night, we heard from a number of people who are looking to have everyone received a first dose earlier than that. We will continue to work with experts, work with the various provinces, and do everything we can to get everyone vaccinated as quickly as possible so we can get back to normalcy as soon as possible. Nous avons
Answer repeated in English. We've always spoken of two specific targets when it comes to vaccines. First of all, we talked about receiving 6 million doses by the end of March. We're already speaking of 8 million now that will arrive in Canada before the end of this month. The other target was to ensure that every single Canadian could be vaccinated by the end of September. We are right on schedule. I can say that I spoke to the different provinces and territories yesterday, the premiers, and they hope to vaccinate as many people as possible with at least a first dose by May. We hope that we'll have good news in the months to come, better news. But we are doing everything we can to vaccinate as many people as possible, as quickly as possible, to get back to normal as soon as we can.
When Donald Trump even threatened to block PPE, there was an uproar in this country. And now you've got the Biden administration actually blocking shipments of vaccines. What do you think about that action by the Biden administration? And are you worried that this kind of response from the United States is going to threaten Canada's shipments of AstraZeneca vaccine?
None of the vaccines that we have been contracted for or promised to Canadians have been blocked either by the European Union or by the United States. We have signed significant contracts for tens of millions of doses that will be arriving in the coming months. And we are confident that there will not be interruptions to those vaccines. But it's one of the reasons why we have signed a more diverse portfolio than just about any other country for more potential doses per Canadian than for any other citizens in the world, because we knew that there was always a potential of challenges around that. That's how we make sure that we're going to be able to vaccinate as many Canadians as possible, as quickly as possible. On AstraZeneca, we have a contract for about 20 million doses this year, and we are looking forward to receiving a schedule on those doses, hopefully in the coming weeks. We will continue to work to get as many doses as possible, as quickly as possible for Canadians. Depuis les débuts,
Answer repeated in English. Since the very beginning, in French rather, since the very beginning, we've signed various contracts with various companies to ensure that our supply chain is resilient, to ensure that if ever there were any challenges, delays, or even products not coming through anywhere, then we would be able to continue to provide vaccines to Canadians. And I can emphasize that no vaccine shipment was blocked by the European Union, by the US, or any other country. We are going to continue to receive the vaccines that we've ordered, and I can reassure Canadians in that respect. I should also emphasize that we have a contract with AstraZeneca to receive 20 million doses this year. We hope to begin receiving them very soon. Of course, we are waiting to see what their delivery schedule is. Louis Blouin, Radio-Canada, question. You said 3 years ago you were not aware of the allegations against General Vance. What do you say to Canadians who say, how is it that the number one of the Army, of the Defense Staff, could be facing allegations and the Prime Minister not be aware of this? Did your Defense Minister not have the moral obligation to tell you this? Are you not aware of information that's that delicate? Answer. It's extremely important for me, as you are well aware, that anyone serving in our armed forces or in the public service or anywhere in Canada has a safe and healthy workplace, as well as the means to lodge a complaint and be heard if ever they face harassment or bullying. That has always been very important for me, and our government has taken this very seriously as well. We've put measures in place to enable a change of culture to provide the resources necessary for people who do come forward. But one thing that we did not do and what we shouldn't do is to give politicians the responsibility for investigating allegations. We need independent, rigorous processes instead. And that's exactly what happened in this situation. Minister Sajjan told the ombudsman to provide evidence to independent bodies that would be able to do a rigorous follow-up. My office was aware that complaints had been made that were directed towards an independent body, investigative body, but there was no follow-up because the information was not provided.
I think everyone knows how important it is to me that women and men who serve in the Canadian Armed Forces, or anyone who works in the public service, or anyone who works in any workplace across the country, has a safe work environment and has the resources and the supports needed to come forward with any allegations of inappropriate or harmful behavior. That is something that we have taken significant steps on over the past number of years, but obviously there is much more to do, particularly given recent revelations about what's going on within the Canadian Armed Forces. The one thing that in all the different measures we've put forward to better respond to allegations and concerns is that we haven't given politicians themselves more tools to investigate allegations of malfeasance or wrongdoing. It's not for politicians to do that. It is for independent, rigorous authorities to follow up in the right way. And that's exactly what happened when the ombudsperson came forward to Minister Sajjan to highlight allegations that he had received about the Chief of Defence Staff. The Defence Minister, quite appropriately, said, I'm not the person who can investigate this. You need to go to the appropriate independent authorities who will follow up on this and take this very seriously. Our job as politicians is to make sure that these structures are there and that any allegations are taken seriously. This is what my office was aware of, that allegations were directed towards independent authorities. Now, it turns out that those independent authorities never received enough information to actually proceed with a full investigation, but that is something that is the right of people to come forward to who don't want to give more information. And we always have to walk that line very, very carefully, and as a government, we always have.
When we first broke the story on these allegations against General Vance, you and your office told us that you only learned of the allegations through our reporting. In fact, I think you may have said that in the House of Commons. But I think earlier this week, or earlier on in the last few days, you yourself have since confirmed that your office did know 3 years ago of these misconduct allegations against Vance. So the first question is, why are we having such difficulty getting a straight answer on that issue? And then B, why 3 years ago? Why it seems like your office, somebody turned a blind eye, essentially, to these allegations.
On the contrary, David, 3 years ago, when the ombudsperson came forward to the minister and said, I have received allegations against the Chief of Defence Staff, the minister, quite rightly, directed the ombudsperson to the independent authorities who could follow up and create that investigation. My office was aware that there had been allegations that were directed to the independent authorities. The substance of those allegations, the details of those allegations, were not known by my office. Now, 3 years later, as these events come forward with details of what those allegations are, I and my office learned about them through the reporting and the questions posed by the reporters at Global News. Il y a 3 ans, quand...
Answer repeated in French. 3 years ago, when the ombudsman met with the Minister of Defense to say that there were allegations against the Chief of Defense Staff. The Minister, quite appropriately and correctly, said, you must take this information to an independent authority that has the authority to investigate these allegations. We were aware that these allegations had been referred to an independent authority, but we did not know the nature of these allegations. And given that these independent authorities could not follow up on the accusations because there was not enough information, the issue was not revisited. There was no investigative process because there couldn't be one. And so a few months ago, when Global News managed to obtain more information on these allegations, I learned of it for the first time, and that is how things unfolded.
The Globe and Mail. Prime Minister, you keep saying in your responses to this that the minister and your government directed these allegations to the independent authorities, but the Privy Council office does not have oversight over the military. So why do you keep saying they were the correct body to send this to when they don't have oversight over them?
Governor and council appointments, like the Chief of Defense Staff, have a line of responsibility that goes through the public service and indeed through the Privy Council office. We've seen a lot of discussions now about the appropriate investigative bodies either within the military or independent from the military. And these are all things that we're looking at very carefully in order to make sure that there are stronger processes in place to make sure that anyone who comes forward with allegations or concerns about misconduct of any type is properly heard, properly supported, and that we create a shift in the culture to make sure that these incidents aren't happening in the first place. And we have taken many, many steps since 2015, Marika, on delivering strengthened processes, better procedures in place. But obviously, there is more we need to do, and we will continue to do more. Évidemment.
Answer repeated in French. Obviously, despite everything we've done since 2015 to increase resources and the means to follow up on complaints or concerns that people may have, we obviously need to do more, and we will do more. Thank you, Prime Minister. That's all the time you have with us today.
We'll now go back to questions in the room since we don't have any queue on the phone right now. Questions for ministers and doctors starting now.
Thank you very much. David Aiken, Global News. I guess I'll start with a question first for Minister Haidu in beautiful Thunder Bay. Know it very well, like it, except for the cold in March. And maybe for Dr. Tam as well. This is from my colleague Eric Sorensen, who he was asking or noting that some epidemiologists now suggest that the new variants, should not be blown out of proportion, though modeling indicates they are more transmissible. So I wondered if I can get your thoughts then as spring arrives, Canadians are itching for a return to more normal life. Is there anything in the data that troubles you at this point? Do you expect a third wave? What can you say to Canadians about that, Minister Haidu and Dr. Tam?
Well, thanks, David, and thanks for the shout out to Thunder Bay. I think I'll turn that to Dr. Tam, though it's a very scientific question.
Sure.
Yes, thank you so much. And we're constantly learning about variants as we're going along. And of course, we try to look towards other countries in the data, such as the United Kingdom and elsewhere, because they were ahead of us in terms of the knowledge. And so we take into account what we learned in that context. But of course, Canada is not the same as England and didn't have the same set of conditions. And we hadn't sort of loosened our measures and put on the brakes just around that Christmas sort of time period as well in many jurisdictions. So the context is a bit different. So we were anxious certainly to get some Canadian data on, how transmissible is this the variant. The predominant one, as I said in my opening remarks, is the B117. And I don't know if you've seen some of the Ontario data, but that's where a lot of the B117 variants are occurring. And the initial estimates in that context for the reproduction number is that is sort of over the 1.2 mark, whereas the current estimate for the reproduction number for the strains prior to that is now just under 1. So there is a difference in transmissibility, of course, between the B117 and the rest. And that might be a little bit lower than what we were seeing in the United Kingdom. But that's also because of the great work that people have been doing in the public health measures. As we see those public health measures ease, that reproduction number may well change due to a complexity of different circumstances. So I think it is really important still to be very vigilant about these variants. They are definitely more transmissible. I've heard accounts of actual outbreaks where the attack rate was that much higher with the B117 variant. Very difficult to stop once this starts. You've seen Newfoundland, what happened there in a jurisdiction that had things well under control. The other aspect of the variants that we are very concerned about, of course, is the impact on severity or serious outcomes. And there is increasing strength of evidence to show that the B117 variant, for example, can result in increased mortality and serious outcomes such as hospitalizations and ICU use. So I think that as we watch this space really carefully, we might just see that in Canada. So we just got to be cautious.
Thank you very much. Follow-up is just for Minister Anand. Minister, earlier this week on Tuesday, we asked your departmental officials what we thought was a pretty basic question, which is, can you tell us where the current vaccines are manufactured? And they sent us an answer at 7:30 last night that there was no answer. So what we're looking for, and I think we've had some of this on the public record, but if you can go over it, what city and country is the Pfizer vaccine that we're getting manufactured in? What city and country is the Moderna vaccine that we're now getting manufactured in? And I know we're talking about where the J&J vaccine, where the AstraZeneca vaccines are coming from, but can you narrow it down rather than just Europe and America to the state, city, and country where the J&J and AstraZeneca vaccines are likely to come from? Are you able to do that for us?
Sure. Can I just clarify? Are you asking about all 4 vaccines or 2 vaccines? Because you mentioned all 4 in there.
I'm asking for all 4, recognizing that I think the last we heard, supply chain discussions are still underway for J&J and AstraZeneca, but feel free to update that. But obviously, we're getting Moderna and Pfizer right now. So we'd like to know the source of the facility where those are coming from. And then can you tell us that clearly you must have some idea where the factories are that are going to make the future AstraZenecas, not the one coming from India, but the ones that AstraZeneca itself is going to deliver. That's what we're looking about. And then also, what plants is J&J thinking about to make the Janssen vaccine that is going to be coming our way in the 3rd quarter?
Okay. So I believe it is on the public record that our doses of Pfizer are coming from the Perth plant in Belgium. In addition, our doses from Moderna are coming from both Switzerland and Spain, given that the process of fill and finish occurs in a different country than the actual production. So again, we're getting product out of Europe. We've been able to get product out of Europe, and it's really important to note that despite kind of transparency mechanisms that the European Union is putting in place, we've been working with our counterparts, and we're getting our product up out of Europe, and that will be 8 million into Canada prior to the end of March. In terms of the production of the 2 most recently approved vaccines, being J&J and AstraZeneca, I've previously indicated that the AstraZeneca vaccine will be coming from the United States. And in terms of J&J, actually, in my conversations with J&J, as recently as this week, we are being told that there are multiple possibilities for the sourcing of the J&J vaccine, and we are still in discussions with them regarding where precisely the J&J vaccine will be coming from into Canada. Suffice it to say, though, that we are expecting delivery schedules from both AstraZeneca and J&J in the very near future. We have 10 million single-shot vaccines coming from J&J, 20 million vaccines coming from AstraZeneca. And in the meantime, because we have approval of AstraZeneca, we made sure to source additional areas of supply for that AstraZeneca vaccine. That was what led to the finalization of our Serum Institute deal for the AstraZeneca Covishield vaccine, a deal for 2 million additional vaccines of that sort on top of our 20 million AstraZeneca doses. So our strategy has been all along, you can see from my response just now, to diversify our supply chains, to ensure that Canadians can have product, have vaccines from multiple sources of supply, multiple suppliers, and multiple countries, so that we are not negatively impacted by any control restrictions that might be placed on us. And that's exactly what we're able to deliver for Canadians. That's the benefit of a diversified portfolio. And we are going to see those benefits manifested over the next weeks and months. As we know, over the month of April, we're on track to receive 7 million doses from Pfizer, Moderna, and AstraZeneca Covishield alone, with 1 million doses per week through mid-May from Pfizer. So that is a very steep ramp up in our vaccines importing into Canada, and we're going to continue to see large numbers in vaccines coming to this country, 36.5 million doses prior to the end of June and 118 million doses prior to the end of September. Thank you.
Thank you. We'll now go to the next question in the room.
There's Marika Walsh with the Globe and Mail. Minister Hajdu, I'm wondering if you can tell us when you first learned there were allegations against the former Chief of Defense Staff, Jonathan Vance. Was it in 2018 as well, or was it more recently? And if so, when?
I wasn't aware of allegations until the information was present in the media just recently.
How your government handled the allegations in 2018. Do you feel that more specifics needed to be brought forward for the government to act, or do you believe that simply knowing that there is an allegation could have or should have prompted a review?
Well, thank you, Marika. I have no reason to doubt the appropriateness of the actions that were taken by my colleague, Minister Sajjan, and of course, having been the minister responsible for the legislation around harassment and violence in the workplace, of course, it is difficult to investigate allegations without details. So I don't know the specifics of the case. I don't feel qualified to weigh in on the specifics of this particular case, but suffice to say, Minister Sajjan has my full support, and these are difficult situations. Clearly, the Prime Minister has made a commitment to strengthen supports and processes for people in the Canadian Armed Forces. And of course, I share the Prime Minister and Minister Sajjan's deep abhorrence for any woman's experience of harassment or violence in the workplace.
Hi, Minister Louis Blouin here from Radio-Canada. The question for Minister Hajdu about proof of vaccination and vaccination passports for domestic use. What can you tell me about what is being considered right now about that? And do you have any worries? The Prime Minister spoke about equity, discrimination for a domestic passport. What do you think about that? And what is being considered right now? What is the reflection of the federal government is about?
Merci pour la question.
Thank you for the question. The issue of a vaccination passport is a real issue.
As a federal health minister, I'm focused on the conversations that international partners are having around vaccine certification as a requirement for international travel. Of course, we believe that Canada needs to be part of those conversations. First of all, to have influence at those tables in terms of how that might unfold, but also to make sure that Canada is not left behind if the world embarks on a new requirement for international travel that requires some form of health certification. And so it's very important that we're involved in those conversations. I share the Prime Minister's concerns, though, around passports or some proof of vaccination for participation in everyday life in Canada. Obviously, there are settings where vaccination is required already to participate. For example, schools and certain healthcare settings, people must show vaccination against certain illnesses. And those are all largely provincial decisions. And of course, they're very difficult ones. But certainly, I know provinces and territories are deliberating about those kinds of decisions that are coming their way as more people become vaccinated.
Is there not a risk that we end up with a patchwork in Canada where businesses, cities, provinces would have different approaches regarding to vaccinal passports? And what does the federal government can do? Can we prohibit that kind of passport in Canada? Could the federal government do that? Et Monsieur Leblanc, n'hésitez pas à vous en mêler.
Mr. LeBlanc, please dive in if you wish to.
I'll start in English and then Minister LeBlanc can help me out in French. The federal government currently doesn't interfere in provincial decisions around, for example, vaccinations in provincial school boards. This is a very common example that maybe many parents across the country will relate to. In order for a child to be registered for kindergarten classes, for example, oftentimes, and in fact, most times, families must show proof of vaccination or some reason why that child cannot be vaccinated. And of course, that's to protect children and their families from common childhood illnesses that used to be far more endemic and of course, very dangerous to children and their families. So these are decisions that provinces and territories take on a routine basis. In terms of participation in everyday life, again, the federal government, obviously leaves many of those decisions to the provinces and territories where rightfully so they have the jurisdictional authority and responsibility to make those decisions.
Oui, si vous me permettez.
If you'll allow. I think Patty Haidu well explained that this question of proof of vaccination is a question that's already asked in provinces and territories, be it at in schools or elsewhere. This is a discussion that the provinces will have to undertake when it comes to providing proof of COVID vaccination. As the Prime Minister mentioned a short while ago, we're talking about the domestic context. As the federal government, we will take care of the international context. Allies such as the U.S., for example, there needs to be consistency when you're crossing the border to the U.S. These are the types of conversations that we will have as the national government in the coming weeks, so that we arrive at fair and appropriate answers.
Hey, good afternoon. My question is for Dr. Tam. My name is Mal Hamidi. I'm with the Canadian Press. You keep saying that every Canadian that wants a vaccine is going to get a vaccine by September. But the chief medical advisor says it's unlikely that vaccines will be approved for kids under 12 by then. So why are you saying that?
Sorry. It's not just me saying it. It's for anyone who's authorized, of course, to get it. Anyone who's eligible, authorized, and want to get it should be able to get that vaccine by end of September. We will get more data from vaccine manufacturers in terms of the clinical trials in younger people, and that would be expected later on in the year. So I think you just have to unpack what that sentence actually means, but nobody's going to be provided with a vaccine that isn't authorized for use in those age groups.
Thank you, Dr. Tam. I think this is what ends today's presser.
Thank you. Merci. The conference has now ended. Please disconnect your lines.